Good morning to the people of our beloved Republic of Trinidad and Tobago. Good morning, members of the media. Welcome to our weekly Opposition Sunday Press Conference, held at the office of the Leader of the Opposition, the Honorable Kamla Prasad Bisesa. On behalf of our leadership, the Honorable Kamla Prasad Bisesa, I would like to welcome all of you, both at home and abroad, who will be viewing and listening to this Sunday press conference. This morning I have with me our distinguished colleague, Member of Parliament for Carnival East, our Shadow MP with responsibility for health and social development matters. I would like to say very briefly in the opening statement that I'm making, I'd like to add that an economic and social storm is brewing in Trinidad and Tobago. And this morning, we are going to connect all the dots to establish a factual basis for what I've just said. But before doing so, we would like to address the COVID-19 crisis that continues to grip our nation. And we have with us, as I said earlier, the distinguished Dr. Rishi Seecharan, who is our MP for Carnival East. When he would have been through with his contribution, I will address a number of critical issues affecting not only the economic health of our country, but the international image of this beautiful, beloved republic. So I will now turn over the proceedings to my distinguished colleague, the Honorable Dr. Rishi Seecharan, who will now address you. Dr. Seecharan.
Thank you very much, Senator Mark, our distinguished leader of government business in the Senate. Good morning, everyone. I would like to begin today by congratulating all of our nation's national scholarship winners. You have all truly gained the rewards of hard work and dedication. I wish you all best success in the future. Thank you all for joining the United National Congress today as we respond to the increasing number of COVID-19 cases recorded in the last 7-day cycle. This morning I would try and I would show that the government continues to fail in their response to the COVID-19 pandemic. In the last 7-day cycle, there were 559 new cases reported between the 22nd and the 28th of February 2023. This was the highest weekly jump in COVID-19 cases since late 2022. The 7-day rolling average has also skyrocketed to over 80 cases per day, and this is also the highest since late 2022. Unfortunately, there have been 8 COVID-19 deaths in the last week, and may they all rest in peace. Of the 58 COVID-19 deaths for 2023, 52 persons who perished were not fully vaccinated. We currently have 53 persons in hospital, with 1 person in intensive care unit and 3 persons in the high dependency unit. COVID-19 cases are set to rise after the Carnival festivities, and here we are faced with the prospect of our elderly and immunocompromised citizens being under the threat of hospitalization due to severe COVID-19. With the surge in COVID-19 after the Carnival festivities, there has been an increase in the number of citizens needing COVID-19 rapid antigen test kits and medications at our nation's pharmacies. According to President of the Pharmacy Board, Andrew Rahman, the post-Carnival increase in COVID-19 cases has led to COVID-19 test kits becoming more difficult for pharmacy owners to source. With COVID-19 test kits in scarce supply, persons with suspected COVID-19 symptoms now do not have the luxury of buying a cheap and effective method of testing themselves to prevent transmission of the virus to their loved ones as well as their co-workers. Many persons are also self-medicating and thus clouding the actual number of COVID-19 cases in the country with over-the-counter medication. Without a doubt, hundreds more are COVID-19 positive with little to no symptoms. These persons can and will innocently affect others and many around them, including those over the age of 65 and those with comorbidities. Private labs are also reporting an increase in the number of persons seeking PCR tests, and there have also been an increase in the positivity of test results. Medical Director of Medical Associates, Dr. Arun Narayan Singh, has also indicated that they have reopened their private COVID-19 treatment facility due to increased demand. Minister Dayal Singh is on record as saying the population can help prevent these numbers from growing by practicing public health protocols, as we have been accustomed to over the last 3 years. These are wearing masks, washing hands, and social distancing from each other, as well as getting vaccinated. But Minister Dayal Singh, why have you made this statement now after the Carnival festivities? Did you not expect persons to practice health protocols during our first Carnival at the end of public health restrictions? Minister Dayal Singh, if you were so concerned about social distancing, why did you not express this concern before the festivities? It is a bit indisingenuous to come now after so many mass gatherings and to tell persons about the 3 Ws. Make no mistake, the United National Congress is on record of supporting Carnival 2023, but we have issues with the way the Ministry of Health has prepared for our national festival. What Minister Dayal Singh should have done is put in place measures to address several of the problems that we are now currently facing. COVID-19 test kits should have been freely distributed to anyone requesting a kit free of charge during the Carnival festivities by the Ministry of Health. Minister Dayal Singh is on record in Parliament of having purchased hundreds of thousands of these antigen test kits at discounted prices from PAHO. Having promoted the mother of all carnivals, Minister Dayal Singh is now telling local citizens that they have to scramble to go and get an antigen test kit to test their status. A Kamla Prasad Biswas administration would have also mandated the Ministry of Health to set up free COVID-19 testing booths at all Carnival hubs around the country. COVID-19 testing would have been free during the Carnival season. We would have allowed citizens to be tested by a trained professional, or perhaps to collect a COVID-19 test kit and to go home at their own convenience and test themselves. It is only by promoting testing citizens would be able to know their status and to break the transmission of COVID-19 to their loved ones and those in the workplace. There are now over 348 COVID-19 positive patients that are being monitored by the Ministry of Health in home self-isolation, a marked increase from the previous week in which we only had 2 COVID-19 persons being monitored by the Ministry of Health. In addition to providing medical support at home isolation, the Ministry of Health should have also set up a national Carnival COVID-19 hotline, whereby persons who have tested positive with mild symptoms could request COVID-19 treatments through this hotline, such as fever and pain medication. This is currently being done in England and many other countries around the world. This prevents persons from having to travel to many different pharmacies while they are COVID-19 positive to seek medication and expose frontline workers such as pharmacists, pharmacist assistants, taxi operators, and fellow passengers to COVID-19. A health professional would have taken their information of their symptoms and their medical history over the phone and would have arranged for the delivery of medication to their residents via courier. This proactive measure would have allowed both local and foreign guests to have a high level of confidence in our nation's ability to manage COVID-19 during our Carnival. Carnival 2023 had much to be desired. It has become apparent that the Raleigh administration expected a much larger turnout from the international community. To date, there has been no official figures of the number of foreign visitors that visited our shores. With numerous crime advisories against our country, the low visitor turnout was obviously due to high levels of crime, but also many stayed away because of the low level of confidence in our nation's healthcare. The lack of basic antiviral drugs and other COVID-19 therapies would have played a part in foreigners' decision to make a trip to our Twin Island Republic. Why risk your life with a third world level of healthcare? Numerous Port of Spain Carnival vendors lamented about the poor sales over the Carnival season and complained of the low turnout of international visitors. One vendor, in fact, from the National Carnival Commission Carnival booth, stated at the Queen's Park Oval that rhetorically, is this the mother of all carnivals? She went on to say she saw almost no one from the bands, and in the last 19 years, it was the first time she had seen Port of Spain look as dead as it was for Carnival. Our response to such an observation is elections have consequences. Quite interestingly, Brazil enjoyed a record-breaking number of persons attending their Carnival. Rio de Janeiro's famous Carnival celebration returned in full force in 2023 and generated nearly $1 billion in business, an all-time high, and it was widely regarded as the greatest show on earth. According to estimates by the Brazilian Ministry of Tourism, the 2023 edition of the Brazilian Carnival attracted over 46 million persons domestically and internationally to the parades of that country. The city of Sao Paulo alone welcomed over 15 million tourists. How many visitors did we welcome here in Trinidad and Tobago, and what was the cost of our marketing budget? Minister Mitchell seems to be mute on the subject. Foreigners had no reservations of going to Brazil, but apparently they had many to come here to Trinidad and Tobago. Besides the one Trini, a patriotic citizen of Trinidad and Tobago, who brought in a cruise ship of passengers to enjoy our Carnival, how many did Minister Mitchell bring into our country? What was our country's return on investment after pumping millions into a Welcome Home campaign by Carl? The simple truth is the Raleigh administration has mismanaged Carnival 2023, and we can no longer boast of having the best carnival in the region. We have been outclassed and outmatched by our CARICOM neighbors, as well as our North American versions of Carnival and the Brazil spectacle. We also have the issue of crime, with 2 men being assassinated in front of hundreds of partygoers on Arapita Avenue. So if it's not COVID, it's crime. I would like to emphasize on behalf of the United National Congress and Kamala Prasad Biswas, our political leader, we are firmly against any plans for a partial or full lockdown of citizens in Trinidad and Tobago due to COVID-19 now and in the future. after 4,347 deaths in a population of 1.4 million, Prime Minister Keith Rowley has continued to allow the incompetent Minister Diyal Singh to manage this pandemic. He has failed and he continues to fail this nation. Since budget of 2023 in October, Minister Diyal Singh has failed to procure an additional complement of vaccines for the vulnerable. He has failed to procure antivirals for those who are already infected with COVID-19. And he has failed to hire additional personnel to man our nation's COVID-19 wards. And quite surprisingly, I saw in today's Sunday Newsday, Guyana, our CARICOM neighbor, is actually exploring setting up a vaccine manufacturing plant in Guyana. And that is how far behind we are here in Trinidad and Tobago. Guyana is seeking to partner with BioNTech to produce vaccines in their nation, and they are also seeking the assistance of the Indian government and their Serum Institute to manufacture vaccines. So while we here in Trinidad are scrambling and we don't even have the best vaccines available for our citizens, Guyana, through Dr. Irfan Ali, is actually considering developing a manufacturing plant for vaccines in Guyana. That is how far behind we are our CARICOM neighbors. This Rowley administration has put us on the back foot, and we are now having to follow in the footsteps of Guyana. Patients have also complained in Trinidad and Tobago of waiting up to 6 hours to get a bed at the San Fernando General Hospital after being admitted through priority care facility. This is not acceptable, Minister Diyal Singh, and more has to be done. The entire health team has many questions to answer, and they will have to account for their actions and their inactions in the not too distant future. Many are dying who do not have to die. We have the highest death rate per capita ratio to COVID-19 in the Caribbean. We are near the bottom of the list in the ranking of countries in the management of COVID-19. Out of roughly 200 countries around the world, we are number 22 from the bottom. We are ranked number 178 out of 200 countries. This is after billions was spent on new hospitals that lack appropriate drugs, the appropriate equipment, and health personnel. Where have the billions gone? There is no accountability for the billions that was spent on COVID-19 by Minister Diyal Singh. Who were the recipients of these public funds? A commission of inquiry into COVID-19 is necessary more than ever. Doctors in the public hospitals are begging for gloves, they are begging for masks and oxygen tanks and equipment to do their jobs. Critically ill patients are unable to get a bed in a reasonable time frame. Doctors are too afraid to blow the whistle on management for fear of victimization and are unable to say a word under the threat of losing their job. Shame on Dr. Paratharam and his team. They have turned their backs on their fellow doctors for a moment of praise from the PNM. Minister Diyal Singh was fully aware that we are roughly only 51 to 52% fully vaccinated in Trinidad and Tobago. There are over 150 countries around the world that have vaccinated a higher percentage of their citizens, with the Maldives, Qatar, the UAE, and Gibraltar having vaccinated more than 100% of their citizens by the number of doses of vaccines that they have administered. Hundreds of thousands of our citizens have not trusted Minister Diyal Singh and his health team and have not taken the vaccine. This is a pandemic of the unvaccinated. Minister Diyal Singh, you are charged with educating these citizens and the benefits of vaccination to save their life, but you have failed. And with our borders open to international travelers during the Carnival season, we have brought in the Omicron subvariant XBB.1.5 into our shores, and this poses a significant threat to our vulnerable and our elderly because of its increased transmissibility. Not enough was done to prepare for this expected surge of COVID-19 cases. During the Carnival period, vaccinations remained pathetically low. Over the last 7 days, only 261 doses of COVID-19 vaccines were administered. This is a pathetic indictment on the Minister of Health. Year to date, of the 58 COVID-19 related deaths, 52 persons were not vaccinated. Minister Dayal Singh, you have been unable to reach those that are unvaccinated with the correct message. We have lost 52 persons to COVID-19 since the start of the year, since January 1st, because Minister Dayal Singh, you have not been on point with your public education message to those citizens. Minister Dayal Singh, you have also been negligent in educating the public about the WHO recommendations, and that anyone over the age of 60 years and have already received 2 doses of the Sinopharm vaccine should receive an extra 3rd dose. And this recommendation was made by the SAGE group, the Strategic Advisory Group of Experts on Immunization. And this 3rd shot should not be framed as a booster shot, but as a 3rd dose of the primary series. 2 shots of the Sinopharm vaccine have been shown to not meet the acceptable level of immunity. And this panel also recommended that persons with a weakened immune system also be offered a 3rd Sinopharm vaccine. And this has been recommended by the WHO since May of 2021. The US Food and Drug Administration has also announced that it has limited the emergency use authorization of the Johnson & Johnson vaccine, another vaccine that is available here in Trinidad and Tobago. The FDA has said in a statement that the change has been made because of the risk of a rare and potentially fatal clotting condition called thrombosis with thrombocytopenia after receiving the vaccine. Cases such as these typically happen 1 or 2 weeks after vaccination. In the US, there is a new warning label on the Johnson & Johnson vaccine that says the Johnson & Johnson COVID-19 vaccine can cause thrombosis with thrombocytopenia syndrome, which may be life-threatening. Why has Minister Dayal Singh not informed our citizens of this new restriction by the FDA? And why is he allowing our citizens to put themselves at risk without proper warning of the side effects of this vaccine? The Express editorial of the 10th of January 2023 has also called for a greater variety of vaccines for those in the public that may want to avail themselves for another shot. And Minister Dayal Singh and his health team has not undertaken to acquire a new stock of vaccines. It's a simple fact that many would want to be boosted and many may also want to be vaccinated, but they do not want the Sinopharm or the Johnson & Johnson vaccine. During the Standing Finance Committee in October of 2022, I implored Minister Dayal Singh to acquire another batch of vaccines. Had we acquired the Novavax vaccine, for example, it would have allayed many of the fears of those not wanting to take an mRNA vaccine, because this vaccine uses a different type of technology to immunize persons against COVID-19. We also have the fact that Minister Dayal Singh and his health team have refused to order the life-saving drug Plaxivir. And here we have the WHO recommendation in which April of 2022, in which they strongly recommend countries around the world to use Plaxivir in cases of moderate to severe COVID-19. And to date, we do not have this life-saving drug on our shores here in Trinidad and Tobago. The Ministry of Health has actually refused to order this drug. Plaxivir has shown to reduce the risk of hospitalization and death by 88% when given within 5 days of symptoms. That means 9 out of 10 persons who have died could be alive today if they had access to this drug. It has also been shown to say 100% of persons who are vaccinated and who take this drug. It is available in every single pharmacy in the United States. Could we have not asked for a small supply from our great friend and ally, the United States? This therapeutic has and will save lives as well as reduce the strain on hospital admissions. Out of the 52 citizens who have died since the 1st of January 2023, because they were not fully vaccinated, Paxlovid could have saved 45 of them. Why has Minister Dayal Singh not ordered this drug? And how many more must die until this drug is ordered and this drug is brought into Trinidad and Tobago? We also have the issue of the Simangal report. And has Minister Dayal Singh and his health team taken any remedial steps to rectify many of the issues raised by the acclaimed and experienced Professor of Medicine, Professor Simangal and his illustrious team? Have staff shortages from the level of executive management to doctors and nurses to orderlies and patient escorts have been addressed? Do doctors still have to do non-medical jobs in our public healthcare institutions? Will doctors and nurses be overworked to the point of exhaustion during this COVID-19 surge that we will currently experience? Have privacy and security concerns of doctors been addressed? Will doctors have to sleep on mattresses as they did before during our previous COVID-19 surges? And would male and female doctors have to share the same room? Would nurses also have to work for long hours in PPE without taking a break or being unable to drink water or go to the bathroom because there's no one to relieve them? And do young doctors still have to cope with the fact that they have very, very short locum contracts of perhaps 1 month or 3 months? And have these persons been rehired in any other capacity within our public healthcare institutions? Will there be as many as 6 ventilated patients per nurse and up to 30 warded patients per nurse? And did Minister Dayal Singh and his health team ever consider procuring tocilizumab as well as other important COVID-19 drugs such as midazolam, methylpenicillin and propofol? How many of these recommendations have been implemented, or have they just been ignored by Minister Dayal Singh and his health team? And then we have been told that the Ministry of Health is in the process of recruiting an independent consultant to assess its response to COVID-19. This consultant will assess the ministry's response to the public health emergency of international concern COVID-19 and to make recommendations to inform the ministry's response in future pandemics. So why are we doing this right now? Don't we have Professor Simangal's report to deal with first? Professor Simangal and his team told the nation of staff shortages and staff burnout. A total of 16 recommendations were made by the committee and included proper data management systems as well as the urgent need for electronic medical records. The Ministry of Health now wants to do another assessment with 1 person on the team. Apparently, Professor Terence Simangal, Professor Pitt Miller, Dr. Anton Komabach, Dr. Vidya Dean, and Professor Donald Simeon recommendations were not good enough, and the government wants a second opinion. We wish this new consultant, whenever he or she may be hired, the best of luck, and we genuinely hope that the assessment is concluded without any undue influence from the oppressive Rowley administration. And we hope this is not another attempt by the Rowley administration to sanitize its failures in managing COVID-19 over the last 3 years. Minister Dayal Singh has also failed to implement universal health care coverage in Trinidad and Tobago, and this has been reflected in our very high death rate due to COVID-19 by those citizens with comorbidities. Universal health coverage is defined as an access to key promotive, preventative, curative, and rehabilitative health interventions at an affordable cost. This was actually made by the United Nations General Assembly, one of its Sustainable Developmental Goals, on December the 12th of 2012. The Raleigh administration has focused on building hospitals to treat sick people rather than educating these persons and encouraging them on how not to get sick. This is due to a lack of vision by Minister Dialson. One must also ask about the promise of the Raleigh's administration that all junior doctors be hired after the pandemic and go out into our countrysides and deal with the NCDs that many in our population will face. What has happened to that initiative, or was it just P&M old talk? Today, we again call for the dismissal of Minister Dialson as the Minister of Health. Many citizens could be saved if he were to demit office and to allow a more competent individual to take his place. We again call for a commission of inquiry into the management of COVID-19 by this P&M administration, as well as an audit into the COVID-19 spending under Minister Dialson's tenure. Billions are unaccounted for, and many lives are being lost due to the unnecessary poor policies of this Minister of Health. I thank you all, and I will now move on to my illustrious friend and colleague, Senator Wade Mark of the Senate.
Thank you very much, my colleague and distinguished friend, for bringing the nation up to date with some of our challenges and the nation's challenges as it relates to this continued COVID-19 crisis that we still have on our doorsteps. Members of the media, ladies and gentlemen, once again, good morning. We have been informed this morning via an article or articles in the Trinidad and Tobago's Express newspapers